This video is for educational purposes only and is not medical advice. Please consult a qualified clinician for individualized assessment and treatment. Today we are going to cover autism spectrum disorder. I'm Dr. Manjal, a child psychiatrist. Autism spectrum disorder is a neurodevelopmental disorder marked by deficits in both social communication and restricted repetitive interests. Both are needed. And these symptoms generally start, or you can notice it when the kid is around 2 years old. The core deficits, as I mentioned, are particularly regarding interpersonal communication, nonverbal communication, understanding the nuance of language, and then secondly, it is also about restricted repetitive interests, like being extremely rigid with routines, extremely rigid with verbal commands, being highly sensitive to sound, smell, or any other sense. And these both, when they are together, is when you term it as autism spectrum disorder. It is a spectrum because it can be mild to severe. Across the US, autism spectrum disorder is one of the most common neurodevelopmental conditions. And autism spectrum disorder can be both influenced by genetics and by environment. And studies have shown a very high degree of heritability genetically, but also environmental influences that could interact with those genetic predispositions, causing a person to display autism spectrum disorder traits or symptoms. The diagnosis involves a developmental history, observation, and also making sure that they can get ADOS if need be, which is an instrument to diagnose autism. The treatment is both non-pharmacological and pharmacological. For pharmacological treatments, you can use risperidone, aripiprazole for irritability, and sometimes even stimulants if there's executive dysfunction. You can also use SSRIs, SNRI, which are antidepressant classes, for mood symptoms. For non-pharmacological treatment, you can use applied behavioral therapy, speech-language pathology, speech-language therapy, occupational therapy, and other interventions. To conclude, autism spectrum disorder is a very complex and an extremely diverse condition. Early recognition is crucial, and also it's very crucial to have supportive therapies and careful symptom-targeted medication that can meaningfully improve the patient's life, and everybody deserves to have a good life. Thank you. This is Dr. Manjal signing out.